Welcome to God Academy. Today we're focusing on a highly important topic and a too often avoided topic: how to support our teammates after a critical event. As anesthesia providers, we work in environments where the stakes are high and outcomes are sometimes beyond our control. When the worst happens, the impact doesn't end with the patient or their family. It stays with us too. This session is about acknowledging that reality and equipping ourselves as a team with ways to respond, recover, and help each other not just survive, but truly heal and thrive. As anesthesia providers, we know that perioperative deaths and critical incidents are rare, but the reality is they're also unavoidable. No matter how skilled or careful we are, most of us will face one of these moments at some point in our careers. When they happen, the impact goes far beyond the operating room. These events can trigger strong stress responses in both body and mind. Some providers describe guilt, fear, or even a sense of isolation afterward. Others notice it's harder to focus or that their performance doesn't feel the same. And here's something important to remember. These reactions can be just as intense when the care given was excellent, even heroic. This isn't about competence. It's about being human. Recognizing that reality is the first step in knowing how to support ourselves and each other through the healing process. When we go through a critical incident, it doesn't just stay in our heads. It shows up in our bodies too. A lot of providers talk about feeling completely drained, not just tired. Some notice stomach issues, trouble sleeping, or even a racing heartbeat that keeps coming back. Those are stress responses, and they can hang around long after the event. On the psychological side, the weight can be just as heavy. Some people pull back and isolate, thinking no one else could really understand. Others feel waves of anger, sadness, or fear. Relationships can take a hit too, whether it's less connection at home or feeling distant at work. And here's the key point. These reactions don't mean you're weak or unfit for this job. They mean you're human. Naming them out loud shifts the story from thinking something's wrong with me to knowing this is part of my recovery. And that's exactly why support systems matter, because none of us should have to carry that weight alone. Let's talk about the idea of the second victim. This term was first introduced by Dr. Albert Wu in 2000 to describe what happens when healthcare workers are emotionally harmed by an adverse event. Think about it. In any critical incident, the patient is the first victim. That part is clear. But providers, the ones who were right there, doing everything possible to save the patient, often carry emotional wounds of their own. That's what we mean when we say second victim. This is especially relevant in anesthesia. We work in high stress, high pressure, high risk environments, sometimes isolated, without immediate peer support. That combination of intensity, risk, and isolation makes us particularly vulnerable when a bad outcome occurs. And naming this phenomenon is powerful. It validates what so many providers have quietly experienced. It tells us you're not alone, and what you're feeling is a recognized human response. And if you've been through it, you know how heavy it can feel, which is exactly why acknowledging it matters so much. When a critical event happens, the first stage is chaos. In that immediate aftermath, providers often feel shock, confusion, and emotional disarray. Even simple tasks can feel overwhelming. That's why support in those early moments is so critical. Then comes what we call intrusive reflections. The event plays over and over in your mind. You second guess yourself, wonder what you could have done differently, or replay moments in your head. Reflection is normal, but without support, it can quickly turn into guilt and self-doubt. As time passes, many providers move into restoring personal integrity, trying to reconcile what happened with their own sense of identity as a clinician. This is where reassurance from trusted colleagues can make all the difference. But for some, the process also includes enduring the inquisition, whether that means formal reviews, tough questions, or even just the fear of judgment from peers. Without compassion and peer support, this stage can feel isolating and even shaming. The real turning point is when a provider receives emotional first aid, when someone listens, validates, and offers support. That's often when true healing begins. And finally, moving on looks different for everyone. Some leave the profession. Some survive but with lasting scars. And some thrive, learning, healing, and growing from the experience. Our role as colleagues and leaders is to create a system where every provider has the opportunity not to just survive, but to thrive, to come out stronger, more connected, and more prepared to keep serving with excellence. One of the most powerful tools we have after a critical event is peer support, and it is often simpler than we think. Research has shown that 60% of providers felt better when someone simply asked, "Are you okay?" That single question can be enough to break through the isolation and remind someone they are not alone. It's not about having all the answers or fixing the situation. Informal check-ins, a quick text, stopping by to talk, or just being present can make a huge difference. These small actions carry weight because they tell the person, "I see you, I care about you, and you don't have to carry this by yourself." We also know that what we sometimes call emotional first aid is critical. Just like physical first aid, it is not about solving the entire problem. It is about stabilizing, supporting, and preventing something worse. In this case, it can prevent burnout, secondary trauma, and long-term distress. The takeaway here is that every one of us has the ability to offer meaningful support. Sometimes it's not the formal program or a big initiative that makes the difference. It's the human connection of one colleague reaching out to another at just the right moment. When it comes to recovery after a critical event, informal peer support is powerful, but sometimes structured programs are needed to provide consistency and accountability. That's where formal support models come in. One example is peer support teams. These are colleagues trained to step in after an event, offering both understanding and guidance. Then there's critical incident stress management, or CISM, which provides structured debriefings designed to reduce long-term psychological harm. We also have resources through our professional organizations. The AANA helpline is available 24/7, connecting CRNAs with confidential support and wellness tools. And the ASA Safe Haven program offers another confidential pathway for physicians who need help, especially around stress, burnout, or substance use concerns. The key takeaway here is that you are not alone. Whether through local peer support, structured debriefings, or national helplines, there are systems in place to make sure no provider has to navigate these challenges all alone. On this slide, you'll see some of the most common barriers providers face when it comes to seeking help. The first is symbolized by the scales: fear of judgment or professional consequences. Many providers hesitate to speak up because they worry their peers, leaders, or even credentialing bodies might see them differently. Next is the gavel: concerns about confidentiality and legal implications. There's often a fear that admitting distress could affect malpractice coverage or come back in a legal review. That fear alone can silence people, even when they desperately need support. Then we see the lock: cultural stigma around emotional distress. In medicine, there's still this unspoken expectation of toughness, that asking for help means weakness. But the truth is the opposite. Reaching out is an act of courage. And finally, the dialogue bubbles: the fear of gossip. Sometimes providers stay quiet not because of formal consequences, but because they're afraid their struggles will become the subject of a hallway conversation. That kind of exposure can feel just as damaging as official judgment. Our goal is simple, but vitally important: to create a culture where seeking help is safe, supported, and normalized. When we reduce stigma, protect confidentiality, and stop gossip before it starts, we open the door for providers to get the support they need and deserve. When a colleague goes through a critical event, often the hardest part is knowing what to say or do. This slide gives us a simple roadmap to guide our support. First, be present and non-judgmental. Sometimes just showing up and sitting with someone without trying to fix or explain things is the most powerful thing you can do. Next, listen. Really listen. Let them share at their own pace and show you're hearing them by paraphrasing what they've said. This builds trust and helps them feel understood and not alone. The third step is avoid. Avoid asking for clinical details too early. Our instinct as providers is to want to break down what exactly happened. But in those first moments, that can feel like an interrogation. This isn't about the chart or the case. It's about the person in front of you. And finally, offer. Offer help navigating next steps and resources. That might mean encouraging them to take a break, connecting them with a formal support program, or simply checking in again tomorrow. If we can do these four things: be, listen, avoid, and offer, we can make sure no colleague has to carry the weight of these experiences alone. When we talk about maintaining a supportive culture, it's really about making sure we don't lose sight of something we already value. That healing isn't just on the individual, it's something the whole team contributes to. First, we need to normalize emotional reactions. After a tough event, it's human to feel shaken, sad, or even angry. By saying out loud that those reactions are normal, we take away the shame and open the door to honest conversation. Second, structured debriefs make a huge difference. Instead of leaving people to process on their own, a quick check-in or a guided debrief creates a safe space to share what happened, how it felt, and what support is needed moving forward. Third, resilience really grows through peer mentorship. Having someone more experienced walk alongside a colleague, not to solve everything, but just to be present, can build trust and connection across the team. And finally, encouraging people to use professional and peer resources sends a clear message. No one should have to go through this alone. Support isn't optional, it's part of how we operate. At the end of the day, maintaining this culture means every voice matters, and every provider knows they're not only allowed to seek help, they're encouraged to. That's how we keep our team strong, connected, and ready to keep giving the best care to our patients. When we talk about moving forward after a difficult event, it takes courage. These moments stay with us, and the weight can feel heavy, but they don't have to define us. First, it's important to acknowledge the depth of the experience and the effort you gave. What you poured into that case matters, no matter the outcome. If you've been there, you know exactly what I mean. And we have to remember, bad outcomes can happen even when the care was excellent. That truth doesn't lessen the sadness, but it reminds us that tragedy does not automatically mean failure. Finding peace often comes in knowing you acted with integrity, that you did everything you could with the knowledge and the tools you had in that moment. From there, the goal is to move forward with renewed purpose, not by forgetting what happened, but by carrying it in a way that shapes your practice, not stops it. And this is where support makes all the difference. When we lean on each other, the weight is shared. We can carry the memory of what happened without letting it define who we are as providers or as people. And we can maintain our ability to keep showing up for our patients with excellence and with compassion. As we wrap up, I want to leave you with just a few simple takeaways. First, critical events affect us deeply. They stay with us, sometimes more than we expect, and that's normal. Second, support, whether from peers or licensed professionals, is what promotes real healing. We don't have to carry these moments alone. Third, never underestimate the power of small actions. Checking in, asking someone if they're okay, or just listening without judgment. Those little gestures can have lasting impacts that ripple far beyond the moment. And finally, we are stronger when we care for each other. That's the core message here. None of us are immune to the weight of this work, but together we can share it, carry it, and keep showing up for our patients and for each other. My hope is simple, that when the next critical moment comes, we don't just care for our patients, we also care for each other. Thank you for your time.